Excellent. I requested you people not to open the handout. One reason. I want audience to participate with me. I'll be asking questions, don't hesitate. If you don't know, it's okay. If you know, answer the question. And if somebody answering the question, I have a small reward. The reward is candy. Candy is made in USA. Mind it, I'm a dentist. Let's see whether I can get some business from you people. I'm just joking around. Friends, before I proceed, as I said, I'm a practicing dentist. I'm not a cardiologist. As a part of our curriculum, we need to know a lot of medical aspects. Heart attack is something, not many people, they know the exact meaning what happens, but only thing we have one thing. My God, this man was walking up the stairs, he was in a good shape, boom, he fell down, died just like that. What's going to happen? I'm sure you must have heard, right? Everybody right here? 30, 40-year-old man, what is the problem? Heart attack. So that being the case, question for you people, what is a heart attack? I want a brave volunteer to stand up and tell me what is a heart attack. Vijay, I'm going to ask you, what is your response? What is a heart attack?
I think whenever the blood circulation to the heart stops, there is a blockage,
Okay.
and heart attack happens.
Okay, that's one good answer. Okay. I need to get one more opinion. What is your opinion about heart attack?
When one of the blood vessels, main blood vessels of the heart gets blocked or it gets constricted, then the blood supply to the brain stops, and that is probably the heart attack.
Okay, give them a big hand. Remember I said candies? Well, I hope you see people play cricket. There you go. See whether you can catch it. One more for you.
Thank you.
Gonna be like heart attack. Now you can open the handout of what I gave. So before I go, time up, I think please remind me 15 minutes. I don't want to take up your time. Alright. The first page, that's the heart right there. If you see these teeny weeny vessels, right there, they are called coronary arteries. Artery is something that supplies the blood to the tissue. You people are kind of right in the sense, or almost right there. What happens in heart attack, these coronaries gets blocked. Why does it get blocked? There is a definite reason for that. The reason being, the blood vessels gets coated with what is called as a plaque material. It's nothing but a fatty substance. Fatty substance, how does it come? Even from eating. Our body produces plaques. As a matter of fact, 10-year-old kid, you can see plaque formation right on the blood vessel. That's normal. But you certainly don't want that to go like this in page 2. What it's going to do is, I just want you people to imagine for a minute a plumbing line getting clogged up, getting clogged up, getting clogged up. And that clog getting dislodged. Once the clog dislodges, next thing what's going to happen? It's going to bleed. Once the bleeding is there, what are the next thing? It's going to clot. So the clot, basically it's going to occlude or simply block the area. Friends, I had the opportunity to go, we have it was like a show, I don't know whether it was here in India, called as a human body. boy, if you get it, please go. He practically talks about human body as to how you can look inside the body. And this was done by some Chinese people. Excellent. Excellent. I tell you, I saw the heart. Size of a fist. This down coronaries, whatever I'm talking about, is like a teeny mini worms. It's a true fact. What happens if it gets blocked? The part of the heart muscle right there will be out of oxygen. Once the muscle gets knocked off from the oxygen, next thing is what's going to happen? What's going to happen next? There is no oxygen for the tissue. Stuck. What is that? It gets stuck. It dies. The tissue dies. Man, again the same thing. This man was walking. Oh, I don't know what happened. He collapsed, died just like that. Why? There is a sudden blockage of the blood vessels right there. It cannot go further. The tissue dies. And if it is out of oxygen for about 3-4 minutes, done deal. It's going to happen like you are ventured with the lock. You want to bang it or whatever it is. So now, having understood this, heart attack, I'm just going to simplify in one sentence. Blockage of, remember this word, coronary arteries. That supplies blood to the heart muscles. I'm sorry, I'm pointing on the right side. You should go on the left side. My heart is on the left side. Okay? So that being the case, now I want your input. Time for some candies. Who is prone for heart attack? I want some answers from the
Anybody.
Obese. Obese people. You got it, sir.
Diabetes.
Do I have to give one more candy?
Blood pressure.
Okay. Blood pressure, diabetes, obese people, then what else?
Obesity.
Already said that.
People who eat fatty fruits, cholesterol.
There are two important things. Let's see, I'm going to give a big candy to them. Very important thing.
Work pressure. Work pressure.
Stress.
Stress, yes.
Sedentary life.
Not doing physical exercise.
You're almost right, please. What is that?
People who don't do physical exercise. Who don't
I'll come to that point in a minute. Family history. Friends, if the family history there, I got to use that word, venerate, I have to respect them. We pray the Lord, please let them not go through the heart attack process. I have seen families after families, father dying out of heart attack, sons dying out of heart attack, daughters dying out of heart attack. This family history plays a very key role. This is not something in our hands, unfortunately. We cannot control that, right? There are controllable factors. As he said, somebody said, obese people, I'll come to that point of obese people in a minute. People with diabetes, blood pressure. Any smokers in this? Okay. Nobody smokes? I'm sure there are some smokers.
I'm not going to tell you.
Good, please don't smoke.
Just to digress, you said about family history. In the family history, there are people getting heart attacks at 85, 96. Is that considered as a family history?
Well, family history, the trend is, normal trend is, father, mother having heart attacks. They don't have to die. That's a family history. So in other words, be cautious, that's all. There is nothing in it, it's not something one is going to die. Play a safe game. When you talk about the safe game, I'm going to come to that point in a minute. Don't smoke, please, whoever it is in this building, don't smoke. If you know anybody smoking, take the cigarette and throw that out.
Don't have to smoke if you are driving background traffic.
That's the reason I roll the windows and make sure the windows are shut. I don't want to get the fumes, right? And I was a smoker and I quit. And smoking is worst thing. Now there are 5 main things. The main things are, as I said, increase in the waist size. Okay? You certainly don't want anybody to have a stomach like this. Can you see this?
Yes.
My chest coming like this, my tummy is going in this manner, this is my tummy. You don't want that. Okay? We don't want, when you talk about the blood reading, HDL to be less. High density cholesterol. We don't want that to be less, we want more. Alright? Then the next one is triglycerides. That's a part of the blood inside. Where do you get the triglycerides? How do you get the triglycerides? Little bit of a controversial issue for. But however, one thing I learned from a doctor, is a South Indian cardiologist, eating rice, a lot of rice. Watch out people, please. Especially during the dinner time. My suggestion is, don't eat rice at dinner time. Period. That's the precursor for triglycerides and you don't want that. If somebody has got diabetes, blood pressure, if you have out of these 5, if somebody has got 3, it's a guaranteed thing, they are going to end up with heart attack. Okay? Once again, those 5 things are excessive weight or obese people. Go ahead, what is the second one? Triglycerides. Alright, number 3 is HDL being low. 3. 4th one. Diabetic condition. Okay. Number 5 is hypertension or high blood pressure. If they got 3 out of 5,